Hello there, you're very welcome to today's webinar. My name is Grushenka and I'm one of the Wellbeing Specialists with Zevo Health. And October is Mental Health Month. And with that in mind, today's webinar is based on owning your mental health. We'll have a short discussion around employers and employees in the workplace in terms of how to keep your mental well-being in check. Some tips and tricks to keep it in check, what to look out for in terms of supporting individuals, and at the end of the discussion, then we'll have some resources that you might find helpful, or indeed to pass on to someone else who may find them beneficial as well. So it's quite a broad topic. We can fit quite a lot into it. So what we've done, we've just condensed it down for a short discussion today in roughly about 20-25 minutes. We'll also have some slides that accompany that, so give you better understanding in terms of in case I'm flying through the slides very quickly. So what I'd like to do is share my screen with you firstly. Now, before we start, just to reiterate that Zevo Health is committed to supporting you on your journey towards improved health and well-being. Our trainings and indeed our webinars aim to provide you with high quality information, supplemented by useful tools, practices, and behaviour change strategies. Now, it's important for you to know that our content and recommendations are general in nature and they do not address specific individual requirements that may apply to you. Our content is not intended to be suitable for professional medical advice, diagnosis, or treatment. So, in that sense, please seek the advice of medical professionals with any questions or concerns you may have regarding your health. So our agenda for today then, we should look on tips on how to own your mental health. So what does that involve? Briefly today, we'll explore understanding the signs and symptoms of mental health decline, tips to prioritize your own mental well-being inside and outside of the workplace, and tips on how to support colleagues and advocate mental well-being. And likewise then, for employers, we'll understand the signs and symptoms, tips on how to support and approach an employee if there are signs of mental health decline, and then resources and useful contacts. So to start off then, it's helpful to have an understanding of what mental health is. So the World Health Organization defines it as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. All very straightforward. Interestingly, there are some facts and myths. So to dispel those, some of them, so certain people have mental health. That is a myth that some people might believe to be true. So we've mental health, we all have mental health. It can fluctuate between positive and negative. So it doesn't apply to certain people. It can apply to all of us at any stage, just as much as our physical health can. Also, with another myth is that mental health problems are rare, and most certainly, particularly in an age where we've experienced pandemic and all sorts of strange happenings over the last while, our mental health illness can affect 1 in 4 people in any 1 year. So even if you don't have a mental health illness, it's likely your best friend, family member, or work colleague will be affected. So it's important to know, how do you support someone, or indeed keep yourself in check? Some of the facts then, people with mental illness hold down successful jobs. This is true. So there is research to back this up, that 60 to 70% of people with common mental health or mental disorders are in work. So the Chief Medical Officer's annual report, Dame Sally Davis in 2014, this is where these statistics are coming from, the chances are you're probably working with someone with a mental health illness at this very moment in time. And another fact, mental health illness can occur at any point in one's life. So no matter what age or an individual can, you can lead a very healthy, well-balanced life, and well-being can be affected at any point in time. They are quite common. Mental health problems are quite common and dependent on what you're facing. So instances of unresolved grief, stress, or overwhelm can transition to diagnosable and treatable illnesses. Now, when I say treatable, that can cover a broad range. It could be manageable, or managing mental illness or ill health. It's quite a broad scope, so we're not talking about specifically about diagnosis of ill health, but in terms of just managing the likes of anxiety and stress that we may encounter. So one of those that we keep in mind is anxiety. So this is defined as a state of uneasiness, apprehension about the future, uncertainties, and a state of apprehension, uncertainty, and fear resulting from anticipation of a realistic or fantasized threatening event or situation. And this can be impaired by physical or psychological functioning. Now, anxiety is common and it's normal, and it derives from the fight or flight response, which is a primal response in terms of when we're faced with a threat or a difficult situation. Our primal instinct many years ago, let's say, for instance, we're being faced by a bear. Should we fight, stay and fight, flee, or freeze? And that's ultimately where it comes from. So in terms of this, it helps us to cope with the situation. So if we feel under threat, we have that uneasiness, we have that apprehension. When there's times of uncertainty, we're not sure what's happening, we can kind of fill in the blanks ourselves, and sometimes think the worst, which kind of adds to our anxiety. So what are the signs and symptoms of anxiety? So if it's interfering with work, social or educational or family life, so the physical symptoms that you'll feel in your body, you might feel your heart is racing with dry mouth. You might have sleep disturbance, whether sleeping too much or too little, muscle tension, headaches, sweating or trembling, tunnel vision, or other health issues flaring up. Indeed, these could be skin conditions or sexual health problems as well. Psychological symptoms then, so we might find ourselves with difficulty concentrating, or a kind of a fogginess, or just can't think clearly, irritability, snapping at friends, family members. You might feel like, gosh, don't know why I did that, came out of nowhere, or feeling like something bad is going to happen. So it's this state of impending doom almost. And you just feel you need constant reassurance that things are going to be okay. And can be referred to the glass half empty. So are you glass half empty or a glass half full kind of mindset? And when you are in that situation where you're feeling, you've difficulty concentrating, it can be hard to see a glass half full perspective. I just move my little face around here now. So a condition, in terms of stress and what's the stress of feelings, anxiety and stress, they can coexist together. So stress is a condition or feeling experienced when a person perceived that demands exceed the personal and social resources the individual is able to mobilize. So you might feel overwhelmed, if you're at work, you have a lot of tasks to do. Looking at them overall can be quite overwhelming, so maybe break them down into smaller pieces. So if we believe we don't have time, we're stuck to timelines, and we have to get something done by 5 p.m. on Friday, or it can cause a little bit of stress when you have that deadline looming. Resources or knowledge to handle a situation, it can feel out of our control. And this can again lead back to the physical and physiological, psychological, and behavioral changes. But stress is necessary. It is a part of life. Everyone experiences it, and it can be helpful. So there are terms as well that we won't go into today. There's eustress and unhelpful distress. So helpful stress again is eustress, unhelpful is distress. It's also important to keep in mind that prolonged stress can lead to depression or chronic anxiety. So it's important that if you are experiencing these stress, that you do seek help either from friends or family members or colleagues. So how do I know if I'm stressed or anxious? This is just a general guide in terms of what you might experience. So for cognitive symptoms, so in terms of your thinking patterns, you might experience memory problems, inability to concentrate, or poor judgment, seeing only the negative, anxious or racing thoughts, constant worrying. And then the physical symptoms then, so aches and pains, diarrhea or constipation, nausea, dizziness, chest pain, rapid heart rate, loss of sex drives, frequent cold. And then we move over to the emotional symptoms. So we could experience moodiness, irritability or short temper, agitation, inability to relax, feeling overwhelmed, sense of loneliness and isolation, depression, or a general sense of unhappiness. Now, obviously, you're not experiencing all of these all at once, but any number of these can indicate, it's almost like it's your body telling you, look, I need to look at things here. I need to see what's happening within myself. And, are there things that I need to kind of pay attention to? So the last one there is behavioral symptoms. So in terms of your behavior or coping strategies, let's say, have you noticed you eating more or less, maybe sleeping too much or too little, as I mentioned earlier, isolating yourself from others, procrastinating or neglecting responsibilities? And I kind of smile because sometimes I procrastinate myself as well, and neglect responsibilities. I'll do that tomorrow. It's fine. Yeah, or I'll do that next week. Using alcohol and cigarettes or drugs to relax. Of course, there's sometimes people do things, no harm, I'll have a drink. It's when it starts to interfere with your life. And, is this a coping strategy that you could replace it with a healthier one, maybe? And some may notice as well you have nervous habits, so nail biting or pacing. And again, it's different for everyone. This is not necessarily a specific list, and it's not an exhaustive list either. But again, it's just something to look out for in others, maybe. So this is a good continuum picture. And as you can see, it's all we have on one end. We have from well, and then all the way up to unwell. So sometimes we can place ourselves anywhere on the continuum. So if we're well, life is great. We're happy, resilient, active. We like socializing, communicating with each other, and our anxiety levels are quite low. If we start to move along that then, and our stress or anxiety starts to increase a little bit, we might feel a little bit anxious or stressed by life events. So we've an exam coming up, or relationship issues, or not being late for work. When we come into the middle, then the ongoing symptoms of emotional stress beginning to impact on your daily life. So it's starting to interfere then, so we start to notice that something might be wrong. And as we move further along the continuum then towards very stressful and anxious, symptoms are intense and ongoing, disrupting daily life and the ability to function. So you could get to the point where you just find it difficult to get out of bed, find it difficult to shower, or it's hard to talk to someone. And at the far end, it can be quite difficult as well when experiencing suicidal thoughts. Some individuals can experience psychosis. They can be at risk of harming themselves, or indeed you yourself may be at risk of harming yourself or others. And this is when it's important to seek help. Now, so in terms of grounding yourself, you are experiencing this. So worry, stress, anxious thoughts, they race, kind of universal or philosophical questions. The what ifs. What if I don't make it to work on time? What if I what if I lose my job? What if I, don't pay this next bill? There's a lot of uncertainty in that. And we also tend to go to the negative. So what if I fail? But we never say, well, what if I do well? What if I don't fail? So we can skip over all that and then go to past regrets or future fears of the what if, of what might or might not happen. So in order to reconnect to that is through your body, being in the moment. One grounding technique to reorient yourself is the 5 senses technique, which I'll go through in a minute. Again, these are just tips, and I'm just going flying through them. Breathing techniques can be quite useful as well. So this is a very easy one. When you're sitting, you just see in the infographic there, if you're comfortable generally sitting, with your legs crossed, one hand on your chest and another on your belly. And really slowing your breathing down and breathing deeply can help calm you down and relax you. So taking a slow, deep breath in for 4, holding it for 4, and then breathing it out quite slowly for 8. And you can repeat this up to 3 or 7 times. And this gradually brings your breathing down and gets you into a calmer state. And once we're in that calmer state, we're able to think a little bit more clearly and anxiety goes down. So if we go back to one of the symptoms, if we have a racing heartbeat, or our hands are sweaty, anything like that, these breathing techniques can bring your heart rate down and slow your breathing. So coming back again to the five senses technique. So very straightforward. As you can see there, it's 5 things you can see, 4 things. So within the confines of where you are in if you're in the room or in the workplace, once you're sitting in your chair, grounding your feet firmly on the ground and comfortable in the chair. Naming 5 things you can see, so things in front of you, and that kind of distracts you from the thoughts that are ongoing inside that you might be concerned about. So saying 5 things you can see. So I see the window in front of me, I can see the light in front of me, I see my computer. 4 things you can hear, so the sounds of the heating system maybe, or people talking, or cars going by. 3 things you can touch, so maybe you could have something, like a stone in your pocket that you like, a smooth stone that you like the feeling of, could be the material of your jumper. 2 things you can smell, or even imagine smelling, your favorite perfume. And then 1 thing you can taste. And again, that's visualizing something that, your favorite food, how that actually tastes, what it's like to chew it and really feel the flavors coming through. And then to go through all that process and then, really experiencing it in that particular moment. And that, again, that takes your mind off the anxiousness or, the anxiety or stress you might be feeling in that time. So positive mental health then. What is it? So it's the ability to manage normal amounts of stress. Everyone has stress, so how well can we cope with that? Maintain and develop positive relationships. So we're able to talk to our colleagues or friends, or, not isolating ourselves from individuals. The feeling of being able to, the feeling of being able and competent in leading an independent life, so that you're able to get up in the morning, you're able to get out of bed, have a shower, get yourself ready for work, and do the things that we need to do throughout the day. And also, when we do have times of stress, that we have the ability to recover from stressful situations. And again, that may be to take time for yourself, engaging in self-care, or again, even just engaging in some small grounding techniques or breathing exercises. So managing stress, being grateful, self-awareness, emotional resilience, staying active, and social communication. So engaging in all of these can help us to have a positive mental health attitude. So as I briefly mentioned there, self-care as well is hugely important. And sometimes we can't stress this enough. Minding ourselves and essentially putting ourselves first, which is not selfish to do, because if we don't do that, we can't mind ourselves and we're no good to anyone else. So self-care is anything that brings you a sense of calm and relaxation or adds the value to your life. So it allows you to manage and cope with difficult emotions when they arise. And again, this is different for everyone. What works for one person may not work for another. And sometimes self-care practices that work for you one week mightn't work the next week. So maybe this week I like taking baths and lighting a few candles and just relaxing. And maybe next week I might like to go for a walk or do some exercise. So it really does depend. Now, it's also important that if, some tips or techniques that you can use, seek support from family and friends. It's also important some might like to engage in journaling or writing. It can be very helpful in terms of getting the ideas out of your head and, onto paper. It can help. It doesn't have to be in any particular way. Just keep writing and see what comes from it. Gratitude and self-compassion practice. So this is just kind of maybe for a few moments each day in the morning or in the evening, thinking about things that you're thankful for. And self-compassion, being kind to yourself. Don't use nasty, critical words or sentences against yourself, or try and speak to yourself or your own inner voice, and speak to yourself as you would a friend. You're not going to tell a friend, oh, I'm useless, or I'm no good, or I'm worthless. And sometimes these are the very harsh words that we use on ourselves. So self-compassion. So be mindful of the words you use towards yourself and be kind to yourself. Some individuals like to engage in mindfulness and meditation. It can be very calming, and it takes practice. just to be in the moment, meditate. There's lots of different variations of it. Some you can find online. You can join classes, and it'll be very helpful and calming. And again, it's very important to have time for yourself. So what we call me time activities are, if this is having a bath, lighting candles, using a face mask, reading, or playing video games. So that's important to have that, your wind down time. I'd like to do to wind down. And again, exercise as well is quite good. It doesn't have to be intense, even if it just means going for a walk in nature, going for a swim, anything that you like, that you like. Sometimes say, oh, I don't really like jogging, or find something that you do have an interest in and that you'd like to keep up. So how do we support at work then? So it can be difficult sometimes if we push ourselves a little bit. That's where the growth happens. So if we push ourselves to start the conversation, starting it is the harder part. So ensure there's wellbeing supports in place. You might have the likes of an EAP program, wellbeing specialists in your workplace. Have a healthy work-life balance. So, trying to minimize stress within work and indeed outside of work, and having that balance. So you have that self-care, exercise, eating well, sleeping well. Taking regular breaks, getting into the sunlight is very important. And where possible, encourage outdoor breaks. So if you can, just try and get outdoors, even for a few minutes when time allows. So you see our little brain is exercising there, which is good. So in terms of, educating yourself on mental health conditions and the recovery process, as I said, there's a huge amount, but even having, straightforward, just having an understanding of it can be very helpful. And again, start the conversation with friends or family, colleagues on mental health. Maybe ask a friend, what are your thoughts on it? As we go back to the myths and facts at the beginning. Do we have a non-judgmental attitude in the workplace? Do I have, just things to question about ourselves. Be an advocate, so supported for mental health in the workplace, and challenge the language used. And I know sometimes, particularly myself as well, say, oh, sure, don't mind her, she's mad. And sometimes you can say a flippant comment like that, but sometimes, it can be, it's just to be mindful of the words that you're using. So how do we support others then? So once, as we said, starting the conversation. So ask twice. So it's an important way of starting the conversation. So if you say to someone, how are you? Sometimes we don't wait around for the answer. You say, no, how are you really? And I say, you know what, I'm not great today. So don't just be going through the motions. And sometimes, sometimes, oh, yeah, fine. But you have a sense, you think, I don't think you're not fine. Offer a safe space for them to talk. Approach the elephant in the room. So don't be afraid to ask how someone is doing if they experience mental illness. If you're aware of that, they've spoken about it previously. You don't have to bring up specific details. Just say, how are things now? Back at work or college, you seem a bit quiet recently. Is everything okay? Would you like to talk? Now, it is important as well that when you do engage in conversations, it's confidentiality versus discretion. If you are having these sensitive conversations with someone, confidentiality may pose further difficulties. So if they are disclosed, for instance, potential harm to self or others, then you would need to involve, professionals or a third party, in terms of support. So you may have to break confidentiality to get the individual support they may require. But do be discreet. If someone confides in you, you don't, it's not office gossip, as we know. You don't go around and start saying, wait, can I tell you what Mary told me? So you can seek further support and collaboration with the individuals. Say, look, what can we work together to be, to get help? So if someone expresses thoughts of self-harm, you may need to seek professional support. And this will require you to break confidentiality. I'm flying ahead there. So what to look out for as an employer. So these are all they are overarching themes, and whether you're an employer or an employee, we look out for similar behaviors, and but generally, it's a change overarching, whether employer or employee. It's a change in behavior, a change in mood, change in the way the individual interacts with colleagues, or change in work output or focus. So as you mentioned then, starting the conversation. Before approaching, decide if you're the right person to start the conversation, because sometimes it can be difficult, of course, and nobody's going to, scold you for that. If you feel that you're not, in a place, I'm not in a place to support that, that's okay. Recognize your own skill set and your own boundaries of what you would like to get involved with or with or not. So if you notice changes in the person's work or interactions with others, approach the person if you can, if you're comfortable to do so. Many factors affect a person's mood. It's important not to assume that the problem is mental health related. There could be many other different reasons also. And there's a nice little acronym that is a good little tip to use, which is CARE. And what does that mean? So we can see it there. We have concern, which is the C. So show concern and describe with facts. A is for the agreed action. So together, collaboratively, you agree on the action that's supportive and non-judgmental. So look, what would you like to do next? Would you like to seek help with a GP? Would you like us to speak with maybe a TL or human resources? Whatever you come to agreement with. Refer, so get additional support. Refer the individual to health coaches or wellbeing specialists in the workplace, EAP program, human resources, GP, whatever is right for the individual, because everyone's different, of course. And then empower the individual to seek support and encourage helpful behaviors. So you're empowering someone to do that themselves. And, in the future, they can have those skills. And then if they do find themselves in difficulty again, they can say, well, look, I was able to work through this previously. So what did I do that was helpful then? Just empower the individual to do that. Now, so helpful tips in terms of what to do. So assess needs and concerns. Listen without pressurizing to talk. Sometimes people may not be in a position to talk at that stage. Comfort them and help them to feel calm, help connect to information or other resources, and protect from further harm. And also helpful tips is do not attempt a detailed discussion of the event causing distress. Ask another to analyze the situation, or pressure the individual or other to tell you their feelings and reactions. If someone doesn't want to talk, they're probably not ready to. And offer a confidentiality, as I said, instead of offering, and instead offer discretion. So if those techniques and tips aren't working, then we go to seeking professional support. So feeling overwhelmed. If we're feeling overwhelmed, the self-care practices aren't helping, emotions affect ability to cope, work or personal life, and they're not comfortable speaking to friends or family. So it may be helpful to refer on then. How do we seek professional support? So seek emotional support from a professional counsellor or psychologist, access work health support such as EAP, and reach out to your GP over the phone. You can also access support from national helplines such as Pieta House, Aware, or the Samaritans. I'll have some of those numbers. So just coming towards the end of it there. Hope you've enjoyed it, and thank you for tuning in today. And we hopefully we'll see you all again soon. Take care.